birthday is today, March 2nd. Joining Dr. Seuss. And we just pulled this up. Joining us in the studio here is Dr. Eric Eby. Thanks for joining us. I appreciate it, Doctor.
Thanks for having me, Kyle.
I just pulled it up. I had trouble in getting to Sawala Salute. Here it is right here. You'd never heard of that book before, had you?
No, I haven't.
No. What is your favorite Dr. Seuss book?
Probably Green Eggs and Ham.
That is a good one.
Yeah.
That kind of teaches kids that it's okay to eat weird things.
Exactly.
And you can pull that out, and that's very important, you know. And especially doing what you do, being in dentistry and everything, you know, you got to teach kids that, you know what, these vegetables might look a little funky, but you still got to eat them.
That's right. Just like everything else in dentistry, there's a lot of education that needs to take place.
Well, and that's why I had you on the program here today, because I was just in your office the other day, and I was happy that I got a clean bill of oral health, which is really cool. But I learned something new that I never learned before, that I could get cavities by kissing.
Well, Kyle, that's correct. And also periodontal disease.
That's kind of scary.
Well,
yes, thank you.
You have to think of the bacteria that causes periodontal disease and cavities just like any other bacteria that can be transferred through saliva and just like other illnesses that people can get that are communicable diseases.
Now, say that word again. What disease?
Periodontal disease, which is gum disease.
Which is gum disease.
Correct.
And so that means the receding of the gums, bleeding gums, that kind of thing?
Well, periodontal disease is actually an active infection of the gums and causes loss of bone, which eventually leads to tooth loss.
See, now this is really interesting. And you bring up the kissing thing, not just because you don't want me to kiss my wife or anything like that.
Or me.
Maybe that comes after the show if you do a good job. No, but you bring this up because oral health is so much related to the rest of our body, which I never thought about until last week when I was in your office. So talk about that.
Well, the complete oral health and complete dental health really affect your systemic health. For instance, periodontal disease can lead to diabetes. Diabetes can affect your mouth and also affect you and cause periodontal disease. So there's a huge relationship between your body and your mouth. And the big push today is to make sure that we're educating patients. I mean, this isn't new information that we just figured out yesterday. But the thing is, we've kind of not been educating the patients properly. And complete health dentistry is now really becoming a big movement. And also for physicians and the way it interacts with cardiac health, joint health, many different things. And the biggest factor here is chronic disease and inflammation. Your body only has so many resources to fight inflammation. And if it's fighting so much inflammation in your mouth, it's going to run out of resources to fight inflammation in other parts of your body.
That's interesting. And is that why you think the governor and other legislators are looking at like this new program, this new Healthy Kids, where they've really spread this thing out across the state? It started in a few counties. Now, by the end of, I guess, in this next fiscal year, it's going to be spread to all counties. Is that why people are getting more into this healthy dentistry and making sure that kids have good habits starting early? Yeah,
because having healthy habits early is going to help prevent chronic disease. And chronic diseases such as diabetes, rheumatoid arthritis, cardiac diseases. So this is just a real positive thing for not only systemic health, but dental health in general.
How many times should I brush my teeth a day?
You should brush your teeth at least 2 times a day.
Should I really?
You know, it's more important to floss.
Oh, okay. Well, I do that. How many times should I floss a day?
Probably once will do great.
Okay.
Great.
All right. And when's the best time to floss?
The best time to floss is before you brush your teeth at night.
Now, why before? Because I always do it after. Now I'm going to have to rewire my brain here. Why should I do it before?
Well, you should floss before. That way everything that gets loosened up with the floss can get taken away by your toothbrush.
Okay, so now my wife told me the other day that she was told that mouthwash doesn't do anything for you. True or false?
Kind of true.
Whoa. So she's part right.
She's part
I hope
right.
She's not listening, because now she'll say something to me.
The biggest thing about mouthwash is that things that are sold over the counter just contain a large amount of alcohol. So that alcohol is not necessarily the kindest thing to your oral tissue. As we know, chronic use of alcohol can cause oral cancer. There are medicated mouthwashes that can be prescribed by your doctor that contain materials such as chlorhexidine, which is a common material that they use to disinfect the skin before starting IVs. You rinse with that, and that helps actually kill bacteria.
Well, what about Listerine?
Listerine is simply about 20% alcohol or 10% alcohol, and it's using the alcohol to kill the bacteria.
Okay, so is that good or bad?
It can be good, but it can also have some detrimental effects if it's overused.
Oh, really? Yeah. And what's overuse? More than twice a day?
Yeah.
Really?
Yeah.
I never thought about that.
Exactly.
Makes my breath feel nice, though.
You could chew some gum.
Yeah, I guess I could do that. Now, gum is okay?
Gum is okay, and gum, mints are okay, and the best kind of gum and mints are those sweetened with xylitol.
Okay.
It's a natural sugar that actually helps decrease decay.
The number one worst thing for your teeth is, what would you say the worst thing for your teeth is?
Not taking care of them.
No, eat. Something that you would eat.
Mountain Dew.
Mountain Dew? That's not what I was thinking. Why Mountain Dew?
That's one of my biggest things I tell kids, because Mountain Dew is, number one, it's acidic. By nature, it has a pH of about 3 or less. And one 20-ounce bottle contains about 12 teaspoons of sugar.
Wow. With that kind of acidity level, you could probably you could probably dissolve a piece of steak in like 2 hours or something like that, couldn't you?
Well, not steak, but you can dissolve an eggshell in a few days.
Really?
Yes.
That's kind of freaky.
It is.
Maybe we should try that on the next show, Tony. Bring in the eggshells and the Mountain Dew, and let's watch it.
All right.
That'll make our green eggs and ham.
Oh,
Yeah,
he
see?
completes the circle, Eric Eby.
Yes.
Thanks for joining us on the program, Dennis. I appreciate it. Eric Eby, and we will be back after these messages.